So going on to the next question. My baby's skin and eyes look yellow. The nurse said it could be jaundice. Is this dangerous and what should we do about it?
Sure. It depends. Also, jaundice, as you know, is a sign of of a little bit overload of a substance called bilirubin. It comes from breakdown of blood cells and or like an overload of blood cells, because naturally blood cells are broken down, and there is a normal pattern to that. But it depends on when this is. Like, is it at 2 days? Is it as soon as baby is born? Is it at 5 days or 7 days or later, right? So I can't tell you exactly like what the concern is. It also depends on other things, like is the baby feeding, the baby eliminating stool and urine, is the baby feeding breast milk or formula, and is the baby active otherwise, is the baby feeding and active. So it depends also, like I said, the timing of when that jaundice appeared and what is the level of the bilirubin in the blood. So that is really the gold standard, and there's different. The different levels are the total bilirubin, and there's different fractions of that bilirubin we look at. So always that first bilirubin is very important, so that you can trend it, how high it has gone, and at what age of the baby we are talking about.
And doctor, could you say that breastfeeding helps with jaundice?
Breastfeeding does help with jaundice, but there are some situations where breastfeeding can prolong that normal jaundice, but it also depends on how much breast milk is being produced. Typically, you may hear like in the first couple of days, moms are not making enough, and that's a very natural process. So as moms are developing more and more, practice at feeding, if it's a new mom, they have to be feeding every 2 to 3 hours. Baby should be feeding every 2 to 3 hours. But if they're not getting enough milk, then they are so called, like what we call is like a decreased intake of breast milk, and that can cause jaundice. But there is some situations where breast milk in itself, due to like a unknown factor in the breast milk, it's well known that sometimes we may have to pause breast milk, use formula, but breast milk is the standard of care. So we tell them, do not waste it, save it, freeze it, you can use it later. But during that first couple of days, it may happen that breast milk can induce a little bit exaggeration in bilirubin levels, and that needs to be followed
And
closely.
doctor, do you find that like babies with jaundice go on to have long-term problems?
So again, it depends on the timing and what the level of jaundice is. Yes, so we are all very scared of the term kernicterus, where the bilirubin can stain the nuclei, the deeper nuclei in the brain. So in those situations, we worry about long-term consequences. So that is why it is very important to know how much is the baby feeding, how high is the bilirubin before discharge. Does it need close follow-up? If so, when? Like within 1 day, within 2 days? So there is just like American Academy of Pediatrics, Indian Academy of Pediatrics has recommendations for these things, and it is very clearly stated at what stage it needs to be followed and what is a concerning level. So your pediatrician should be able to guide you, but if there is any need for escalation of care, like IV fluids are needed sometimes, or there is a phototherapy is needed sometimes. There is something called a billy blanket that we send babies home on. So if they're feeding and they're doing well sometimes, and if there's a level that we anticipate it is going up, we send babies home on what is called a billy blanket. But these babies may need what is called intensive phototherapy, which means that it just the billy blanket will not cut it. Will need phototherapy, triple phototherapy, and IV hydration. And sometimes in the extreme situations where we are talking about, we are very worried about kernicterus or this bilirubin staining the nuclei in the brain that can lead to irreversible damage. We do something called exchange transfusion, and it should be done in the ICU setting. Definitely. And if any concern for the jaundice levels going up closer to that number, even pediatricians, refer to them right away. They send them away to the intensive care unit. So it takes preparation. It takes at least 2 hours of preparation, because what we are doing is exchanging that blood out. Take the blood out, give baby new blood, so that high bilirubin levels, the circulating levels of bilirubin are taken down by an exponential amount, and it does not affect the brain.
Mhm, mhm. Thank you so much, Doctor. I personally feel like I'm learning so much. Thank you.